Hello, Melinda with Museum of Mortality. I wanted to talk a little bit more about Dr. Robert Liston. This is the knife that he had created for him for doing amputations. Now, he was born in 1794. He died in 1847. When he became a surgeon, they felt that a lot of disease was caused by bad air, otherwise known as miasma. They didn't have any type of cleanliness. They didn't have any antiseptics yet. And so a lot of the doctors referred to the operating theater and the smell that came from it as the good old surgical stink. So a lot of the times they just kept a bucket of sawdust and other things there that the nurses and people would throw onto the floor to help soak up the blood, and they might sweep it away later. And it was known practice for a doctor to walk into an operating theater wearing a leather apron covered with every bodily fluid from every patient he'd ever worked on. His tools might be so encrusted with blood that they would be completely black. Because back then, that was your badge of honor. You earned every drop of those bodily fluids, and it showed that you were good at what you did it often. They didn't really understand that if you went from the morgue into birthing babies, that you carried that disease with you, and that's one of the main reasons for the heightened amount of childbed fever. So there was a lot of other things that went on during that time frame. With surgery, it had to be done as fast as possible before your patient died of blood loss or shock. And Dr. Robert Liston was really known for not only his speed, but also for his showmanship. He kept saying to people as he'd walk in, "Time me, gentlemen." So he was known to have that flair, and that's one of the reasons that he ended up having a 300% mortality rate on one surgery. Now, anesthesia wasn't introduced until 1846, but Dr. Liston was the first person to do a public use of ether in a surgery in Great Britain. And when he got done doing the surgery, that one was timed at like 28 seconds from start to finish. And when he got done, he announced, "This Yankee Dodge gentleman beats mesmerism hollow." In other words, the patient didn't move, didn't cry out in pain, and so it made the surgery go even faster. And unfortunately, he passed away a year later. But from there, this is where we get this knife from. So we'll be talking more about Lister coming up soon, because a lot of people get the two confused. Completely different people, and we'll talk about Lister next.